Hi, everyone, and welcome to the next episode of TILLY. I'm your host, Marissa Caruana. Most of you know me as Lupus Chick. I'm so excited for this episode. As you know, TILLY is brought to you by the Lupus Foundation of New England. It is a weekly series featuring different experts, other lupus patients, advocates, and nutritionists, everyone that you can think of. Today, I'm super excited to have another Marissa here with me. Dr. Marissa McCarthy. So I am going to let her jump in. Just so you know, today we're going to dig into sleep, pain, chronic illness, and brain health, and how they're all sort of working together. So Dr. Marissa, which is what I like to call you, it is so wonderful to have you here. Thank you so much for being here with us.
Hi, everyone. My name is Marissa McCarthy. I am a physical medicine and rehab physician. I live in Tampa, Florida. I have been practicing for over 12 years now. I have a subspecialty in brain injury medicine, and my passion is actually about brain health. So I feel that if you have a healthy brain, you're going to have a healthy body and live the best life that you can possibly live. So a lot of things play into having a healthy brain. And there are certain things that we can do just in our lifestyle to help improve the health and fitness of our brain. So I think that's what we're going to be talking about today.
Absolutely. So we're going to dig into all of this. Now, there's a couple of things that I kind of wanted to get through. So there's a lot of people, obviously, in our community that have lupus, and a lot of people that have overlap disease. And in those areas of autoimmune disease, sometimes the brain is affected. So it is an organ that I'm sure you know, obviously, lupus can attack. So it could be something that already has, I guess it would be called an injury, like if someone's having mini strokes or seizures or brain aneurysm or even inflammation of the brain that can happen with lupus. So I guess first I wanted to sort of dig into the sleep aspect, and you call it sleep hygiene, which I love that terminology. And sleep is I think that one of the most challenging things for people with a chronic illness for a variety of reasons. And when we don't sleep well, it tends to bring on additional flares or an increase in symptoms. So if you could start, like, share with everyone really what is sleep hygiene, and for people that are chronically ill, like, let's go through the steps that they can make a routine or a ritual so that they can improve their sleep hygiene.
Sure. So, yeah, just like you touched on, anyone with a brain trauma, it doesn't necessarily have to be an external force. Like you mentioned, strokes or encephalitis, inflammation of the brain, or cerebritis, as many lupus patients may get, certainly need sleep in order to heal. Because during the deepest phase of sleep, that is actually when it allows your brain and your body to recover and repair itself. There's this really cool system in the brain called the glymphatic system. Kind of sounds like lymphatic, but it's with a G. And it actually is a time when the brain is able to remove all the toxins, flush them out, and allow those cells that are able to repair to come into play. The thing about sleep is you have to be consistent. So when we say sleep hygiene, it refers to the fact that you almost have like a sleep schedule and the same routine that you're doing every single night. And there are certain things that can come into play, things that you want to avoid and things that you want to do. So, some of the common things that we recommend for sleep hygiene, number one is having a consistent bedtime every single night of the week, including the weekends. And you sleep the same number of hours from the time you go to bed till the time you wake up. And ideally, that's 7 to 9. That is the sweet spot for the time that your body needs to rest and repair. Because if you think about it, throughout our lives, a majority of the time is spent sleeping. And you think about children and babies, that's when they grow and they're able to lay down new memories, just like we are as adults. So it's a really important part of our day-to-day life is sleep. One of the other things that is recommended for good sleep hygiene is having a consistent kind of bedtime ritual, if you will, something that you do to unwind, whether it's a bath, a breathing exercise, it could be, aromatherapy, or you light a candle or something like that. So you find what helps you relax and kind of unwind for the day. Another thing we recommend is avoiding caffeine, usually no later than noon. The reason that is because it takes time for the caffeine to leave your system, and there's several half-lives. So even just one cup of coffee from Starbucks will actually take over 24 hours to completely be out of your system. When the caffeine is in there, from a scientific standpoint, it binds to certain receptors that, if they weren't bound by caffeine, would actually trigger your brain to shut down and start to go to sleep. But when we drink caffeine, it remains active. So that's why you want to avoid caffeine after midday. Naps, which I know are big, especially in the chronic illness community. It's okay to take naps. You just want to make sure that you limit those naps to about 20 to 30 minutes at a time. Because what happens is, if you go beyond that, it's almost like your brain's thinking it's time for my actual sleep. And then it can affect your sleep later that night. The other thing that we like to talk about is different foods. You don't want to have a big, heavy meal before you go to bed, because it takes a lot for your digestive tract to start to work and do what it needs to do to get the food down through your stomach and into your intestines. And if it's focusing on that, it's not going to allow you to sleep. Another big one is alcohol. A lot of people include alcohol in their lifestyle, and in moderation, that's okay. The problem with alcohol is it will actually initially help you fall asleep, but then it may wake you up a couple hours into your sleep. So you're not getting that full spectrum of the 7 to 9 hours without having times where your body is just waking up. In addition, it's a diuretic, so it's causing you to get up and go to the bathroom in the middle of the night. So that leads to the next thing. You kind of want to avoid a lot of beverages before you go to bed, even if it's just water, because if you're waking up at night to go to the bathroom, it's disrupting your sleep. Another thing about sleep hygiene is the temperature of the room. We tend to think that, we want to be cozy under the covers. The ideal temperature for a good sleeping environment is like 67 degrees. So for people like me in Florida, that is going to be a big electric bill to keep your house at 67 degrees, especially in July and August. So understandably, you just want to try and obtain a cool room temperature so that you can really allow your body to relax and you can be cozy under your covers in that good environment. For some people, they need a noise. So it can either be a fan or a white noise machine or complete silence. That's also really important when you're trying to sleep. Blue light exposure. That's any screen, phone, iPad, TV, computer. We are all victims of doing that before we go to bed. And that's something we really want to try and avoid for at least 2 hours before we're going to sleep. There are blue light blocking agents. There's certain things you can put on your screen. There's certain glasses that you can wear to try and block the blue light. But also keep that in mind if you use a nightlight. You want to make sure that the light that you use to light your path is actually of the warmer tones. So more like in the red family. That would be better for the environment that you sleep in. Another thing that's important is that the bed is just for sleeping and intimacy. You shouldn't be watching TV in bed, watching movies in bed, on your computer in bed. You want to maintain that the bed is just for sleep. And then the last thing that we talk about with sleep hygiene is kind of having some sort of accountability for what you're doing. So this day and age, we have so much technology. So you can there's a lot of different wearables out there. whether you do a ring or a watch or a Fitbit, or there's a lot of different options out there. And what it does is it tells you how efficient you are at your sleep. So the number of hours that you're in the bed versus the number of hours that you're sleeping, the number of times that you wake up during the night. And really what it's monitoring is your heart rate, your respiratory rate, and your movement. So through their algorithms, they're able to kind of come up with a general idea of how efficient your sleep is, and then you can adjust based on that. The one other thing I want to mention here is sometimes there are shift workers, right? So they can't go to bed at, say 10 o'clock and wake up at 6 or 7 in the morning. They kind of have that alternate shift where they work at night and then they sleep during the day. For them, it is really important to try and get, window coverings to make sure that it's completely dark when they're sleeping. Again, the noise thing is a big issue for them. So, if you can't adjust your work schedule, you really need to try and maintain a really good sleep environment, so that you're able to obtain what you need during the day when other people are mostly awake and out there. So that's sleep hygiene in a nutshell. There's obviously a lot more that you can do, but hopefully those are a few little tidbits that will help get you a good night's rest.
Absolutely. Those are amazing tips. Thank you so much. So, just hearing you tell us about them, I know that there's some sleep hygiene areas that I am falling short in for sure. I remember reading something that you wrote because Dr. Marissa is just wrapping up a book, and I was really surprised at how long caffeine actually stays in your body. And I think we think of coffee, but then there's also obviously green tea, there's chocolate. So there's other areas that we might be getting, caffeine that we're not necessarily thinking about. Maybe we're eating them late at night. So I think that's something for people to, keep in mind. So also I wanted to talk to you about pain. Obviously, chronic pain is something that so many people in the lupus community and the autoimmune community struggle with. So I'm curious because you are not just an MD, but you also have you're an acupuncturist, you are a yoga teacher. So you have all these like complementary and alternative therapies that you also work with. So I want to talk a little bit about the relationship of how chronic pain can affect your sleep, your quality of sleep, and when you're dealing with a chronic illness, how do we sort of balance asking our physician about medication or trying to go more of the complementary alternative route as far as pain and just figuring out what are our options. Some people may not even realize that there are options aside from pharmaceutical drugs. So, like I remember, I recently told someone that magnesium powder helps me sleep. Something simple like that, just like little things. I feel like we can add like little things one at a time and see like what's helping. So, can we explore that area a little bit?
Sure. So it's funny because pain and sleep actually do go hand in hand, because if you're in pain, you can't sleep. And then because you haven't slept, now your pain is worse. So it becomes this vicious cycle. So we have to find a way to break that cycle. For me, I always like to try things that are not pharmaceutical before, I'm slapping someone with a medication. The reason that is because all medications have side effects. Sometimes they're wanted side effects, but most of the time they're not wanted. Certain things, like you mentioned, certain supplements can certainly help with sleep. And natural things like melatonin. Melatonin works more on what time you're going to fall asleep. So it works on what we call your circadian rhythm, your body's natural time to fall asleep. So by taking melatonin, that kind of adjusts what time you're going to go to bed. The magnesium is great. Magnesium is great for headaches, it's great for pain, and it's great for sleep. So for me, that is a quote unquote medication, but really it's a supplement that has all the side effects that we actually want for someone that has chronic pain and sleep issues. The one thing you have to just keep in mind with magnesium is if you take too much, it can upset your stomach. So just knowing the right amount for you is something you kind of have to play around with. In terms of alternative modalities for pain, absolutely. I mean, massage, exercise, acupuncture. There's something called alpha stim. And then obviously, yeah, yoga is great. Depending on where the chronic pain issues are, you certainly may need to adjust your exercise regimen. But anytime that you can increase blood flow to the muscles, you're going to have repair. And again, as I mentioned before with sleep, even though the brain is repairing itself during sleep, your body is also repairing itself when you sleep. So sleep is really important when it comes to pain. Um, there are a lot of other medications that you would normally be prescribed for pain, and those medications can actually affect your sleep cycle. So, again, they really do go hand in hand. So, really trying to get a handle on managing the pain will actually improve the sleep. When you improve your sleep, the pain's going to get better.
So absolutely. So it is all interconnected. I guess I just want to ask you because, and I'm sure we're going to get some of these questions tonight. What happens, or what would you say for someone that is telling you, I'm on high dose corticosteroids, which can obviously give you insomnia, or I'm on other medications that affect my sleep, and we need those medications to keep our lupus symptoms down. um, is there something to taking those types of medications maybe earlier in the day, or can you use some of these other tools like a melatonin or a magnesium supplement, or like you said, these rituals of maybe taking a bath before you go to bed, or maybe even doing like mindfulness or meditation and breathing, in a cool dark room, like, because I know a lot of people struggle in this area, and we call steroids the devil's tic tacs because so many of us are on them, and they are amazing, but they really do cause so many side effects. So, can we talk about that a little bit?
Sure. I mean, you're absolutely right. Steroids do amazing things, and they also do things that we'd rather not have happen. Um, just as sit here to kind of just give my opinion, no matter what, you have to speak to your personal provider to determine what works, in your regimen. And certainly anytime you add a supplement or another medication, you have to make sure there's no drug interactions. A lot of pharmacists are very knowledgeable when it comes to how things interact. They're also knowledgeable on what I mentioned earlier, something called a half life, right? So when you take a medication and your body starts to break it down, a half life is however so many hours for half of it to be gone from your system. So it's not like you take it and 6 hours later it's out of your system. So that's definitely something to keep in mind. If you feel like it really peaks at a time when it's time to go to bed, you may want to adjust the time that you're taking it. And if that peak effect affects your sleep, then you certainly want to try and take it a different time of the day. But again, I really can't recommend for anyone in general, but as an individual, I think it's certainly something to bring up with your healthcare provider if you're really having a lot of issues with sleep. Just in terms of what time you're taking things. Certain medications are more activating and they're more likely to keep you up at night. And some are more, in that depressing category where they actually help you sleep.
Okay, good to know. I'm going to segue a little bit into something completely different really quick.
Mhm.
So, in the chronic illness world, when we talk about the Y word, which is yoga, sometimes it can bring up a little bit of frustration. I personally love yoga, but sometimes we get people they mean well, but when you talk to them, or they ask you what's going on, and you mention that you have lupus, sometimes we hear something like, oh, well, my friend did yoga and she's completely better now. So, and it's when you have like a severe chronic illness, like and when people mean so well, and they're like, well, just try this, it cured so and so, and we get it, like we understand, like that's maybe they're just trying to help, and they heard something good from someone else. So, but I try to tell people, like, yoga actually for me was something that helped me relax because I have such severe anxiety at times. But there was one type of yoga that I particularly love, and it's restorative yoga. So can you share a little bit about like how that actually can help calm like the nervous system? And there's a lot of people in our community that have mobility issues. So if there's even poses that you could potentially do in bed or on a couch or even in a chair, like something like that, are those things possible? And how could that affect, rest and just getting yourself sort of calmed down to go to sleep?
Absolutely. I mean, there are so many different forms of yoga. I think restorative yoga is great. We actually use restorative yoga even for, professional athletes. It's a way to really get like these deep stretches and allow the body to just relax into the pose. So the thing about yoga is, in this day and age, people think of yoga as a fitness routine, but really, yoga is meant to guide you. It's meant to open your eyes and your heart to balance and harmony. What I do on the yoga mat is going to look very different than the person next to me on the yoga mat. And it's about honing in on yourself and understanding who you are, what your limitations are, and how much you want to push yourself. And it's about moderation, finding that perfect balance between too much and not enough. And for someone with a chronic illness, it may very well be chair yoga to start out with, and that's fine. There can be some great relaxation techniques that happen in a chair. You don't have to bend over or stick your legs behind your head to call it a yoga practice. The biggest thing about yoga is the breath. And by focusing on the breath, you are calming the mind and you're allowing the mind to become limitless. And you have that ability to really just take out all of the day's stress, all of life's, rat race, if you will, because we're always go, 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 go. And if you just focus on your breath, you can actually clear the mind, heal the body, and you are able to just become one with yourself and find that harmony. And when you find that harmony, you can take what you've learned on the yoga mat and apply it to life. So for me, a yoga practice is more than just seeing if you can touch your toes. And it really should be that for anyone that wants to practice yoga. It's not a fitness routine. The monks who practice yoga so that they're able to meditate longer. So if they're able to keep their bodies nimble and supple and maintain those postures, they are actually able to prolong their meditation and their mindfulness. So they're not doing it to be fit. Fitness becomes a byproduct of yoga, but it's not meant to be a physical fitness routine.
I love that. I think you gave the best explanation of yoga of anyone I have ever interviewed. And you said something that really stuck out. You said it allows the mind to be limitless. And I think that's going to be the quote for this episode, because something that people with chronic illness struggle with is they feel like there are so many limitations on them every single day, that their mind maybe wants to do things and the body doesn't cooperate. So I love that statement. um, and I wanted to touch on that, like for people that are maybe, they can't exercise, and it's, or they can't exercise a lot. I think we obviously live in a society, especially with social media. It's like we have like so much fitness and stuff kind of thrown at us, and it's like extreme fitness. And for us, like our community, that's not a reality for the majority of us. um, and I want to encourage people, because years ago I was in a wheelchair. My physical therapist, my our goals for the day were 1 to 2 minutes of activity, and that's all that my body was able to do. And obviously through the years it's gotten better. But I remember you said something to me not too long ago about, and even if for someone watching this time frame might be 3 minutes or it might be 5 minutes, but you said do not exercise to exhaustion because it can actually make things worse. Can you explain that a little bit?
Sure. Anyone with a chronic illness, or let's say muscle weakness. If you exercise a muscle to fatigue, it can actually damage the muscle and make you weaker. So that's what I was referring to when I said you don't want to, exhaust yourself. So yeah, certainly anybody that has those limitations, you want to start low and go slow. You're not joining a CrossFit, the minute you start on an exercise routine. One of the other things I do want to mention about exercise, it is actually helpful for sleep, kind of what we touched on in the beginning. But an important thing to remember is when you do the exercise. For some people, if they exercise too close to the time that they're going to go to bed, it actually does amp them up and, affect their ability to fall asleep. So the recommendation is no more than 2 hours before bedtime. So you want to try and, if you go to bed at 10, don't exercise after 8 p.m. However, exercise does have great benefits, but you don't have to run a marathon. You can do simple things. Believe it or not, so we have a lot of immobility patients, like patients that are in bed, unable to move their muscles at all. And the amount of lean muscle mass that you lose being immobilized is ridiculous. If you're in the hospital for a month in a bed and you're not able to get up out of bed, you lose half your muscle mass. Half. So
Wow.
doing simple things, just like what we call ankle pumps, like pointing and flexing your toes, drawing your knees up and down in the bed, actually activates your muscles. Um, you're not lifting weights, but you're using your body weight. So that actually helps maintain that lean muscle mass, which keeps us healthy. Um, it's very important for bone density too, because obviously if you're not moving very much and you're not doing a lot of weight bearing, it has an effect on your bones, and that can lead to osteoporosis. You get fractures, and we definitely want to avoid that. So that's why weight bearing exercise is good. But if you're unable to do that type of exercise, simple things like just contracting and relaxing your muscles are actually good. There's several different kinds of exercise, but the safest one for people with chronic illness is something that we call isometric. Super simple. Like you push against the wall pushes back against you. And that is contracting the muscle, activating it, but you're not putting any stress or strain on the joint. So, like I said, I mean, you can do that in all realms. Honestly, standing does it. So the floor pushes up against your feet and your feet push down against the floor. So, standing exercises for people that are mostly in wheelchairs or in the bed, if they're able to just stand for a few minutes a day, even if it's with assistance, you're able to activate those muscles to prevent, that muscle from being atrophied.
That's awesome. That's good to know. And I want people here to know that there are so many videos like on YouTube and things like that for people with chronic illness. There's bed exercises. There's exercises for people that are in wheelchairs or need to be sitting in a chair. Very simple. I'm sure they can look up isometric exercises as well. Um, so before we close, I just wanted to sort of circle back, like with the whole sleep hygiene. How does someone like get started? Because you named off multiple things. Like, should the first thing be, I'm going to try to get my sleep sort of in this time frame at night, and that be like the first thing they add, or can they add a couple of things, at one time? Like, what would you suggest?
Yeah, I mean, it's just like anything, when you're starting something new, I start with one thing and then you build on it. Ideally, for this, like I mentioned, consistency is key. So trying to have the same bedtime every night, start there. Then add something else. Maybe don't watch that last show in bed, and try and fall asleep with the TV on. And then think about your caffeine consumption and when your last cup of coffee or chocolate, or hopefully you don't drink sugary sodas, but if you do, those also have caffeine, especially the darker ones. Um, and then even tea, yeah, herbal teas are great because they typically don't have caffeine, but just remember the diuretic effect of teas. So again, you don't want to have tea too close to bedtime because it could wake you up at night to go to the bathroom. But yeah, just start with one thing, and then once you have a handle on that, add something else. I mean, it's obviously easy to change the temperature of your room, darken the shades, add a fan, a white noise machine. You can do those all at once. It's the lifestyle changes that you have to adopt that happen over time. But when you do something for 3 weeks or 21 days, it becomes a habit. So by going to bed at the same time for 3 weeks in a row, now your body's going to be used to it. Not having chocolate right before bed for 3 weeks in a row, you know, then your body's going to recognize, this isn't coming into my system anymore. I don't need it. So definitely consistency is my number one takeaway.
Yeah, I think like people think of like, oh, having desserts. So we could have like chocolate syrup or chocolate ice cream, chocolate cake, maybe a chocolate bar, and maybe you don't really think about that as caffeine the way like, well, I'm not drinking coffee at least, but you're getting it in other areas. I think it's really important to remember all of that. Um, so 21 days, everyone. Try to try to stick it out for that long. Let it become a habit. If there's anyone here that wants to share some of the things that they do before you go to sleep, feel free to write them in the comments. You can also ask questions. I'm going to be answering questions. Dr. Marissa is going to be answering questions. So I hope that you enjoyed this episode about brain health, sleep, chronic pain, exercise. We touched on so many incredible topics. Thank you so much, Dr. Marissa. I absolutely adore you. You're amazing. And I hope that you come back on TILLY.
Oh, I would love to come back. Thank you for having me.
This was great. So everyone say hi to Dr. Marissa below. Feel free to comment, question, and thank you so much for enjoying this episode of TILLY with us. A little bit darker in the background as normal. Luckily, Dr. Marissa stays up late like I do. So thank you again for being here, and I will see all of you next time on the next episode of TILLY. Take care.